افغانستان یگانه شبکه تلویزیونی ملی افغانها در خارج از کشور.
توانا بود ارکی دانا بود، ز دانش دل پیر برنا بود.
دلای او بخون که خدای پنامه گران و قدران دوستان سلام علیکم هیله دچه رو خوشحال هوارا مسایی او دنن رزای ده پوهن رناده په اخبرونه دیر خیر اغلاست زه مریم اسماعیل ارسلا دا اخبرونه تاسته ده آریانا افغانستان نریوال شبکه خبران دکام او ایله لرم چه دستاس زر پور او استفاده و رسیگی بینندگان عزیز و ارجمند برنامه دانش رو شناهی است با آرزوی صحت و سلامت شما برنامه امروز آغاز میکنیم. امیدوارم شاد و صحتمند باشین و هفته خوش و پرثمره را در هر گوشه و کنار جهان که هستین با عزیزانتان به خوشی سپری کرده باشین و باز هم خوشحال هستم که در برابر شما عزیزان قرار دارم و بهتون وعده میدم که برنامه امروز هم یک برنامه بسیار مفید و خوب براتون است و قسمی که هفته گذشته براتون وعده داده بودم برنامه امروز در مورد دیپرشن و افسردگی است و یک موضوع افسردگی و دیپرشن موضوع بسیار مهم و حیاتی است و بعضی اوقات ما سطحی و سرسری فکر میکنیم، بعضی اوقات فکر میکنیم که شاید تقصیر از خود ما باشه، نمیخوایم کمک بگیریم در موردش صحبت کنیم. یک مشکل است افسردگی که در هر سن و سال برای هر انسانی که باشه یعنی با خوب میپیونده و دست میده. پس خوب است که آگاهی ما بیشتر شود، هر قدر معلومات ما زیاد باشه در این مورد و آگاهی بیشتر داشته باشیم نه تنها خود بلکه عزیزان خود هم میتونیم که کمک کنیم. مخصوصا البته با دنیا آخر میبینیم که جوانای عزیز ما نه تنها جوانای ما بلکه در سراسر جهان جوانا و نوجوانا به خاطر دیپرشن چون که کمک نمیشن و یا ای که به اندازه میرسه دیپرشنشون که باعث از اینش سرانجام به خودکشی میشه و این موضوع است که باید زیادتر سرش صحبت شود و زیادتر روشنی انداخته شود و زیادتر در موردش آزاد فکر کنیم و فکر نکنیم که یک عیب است که اگر ما کمک بخوایم، اگر ما در موردش صحبت کنیم. به خاطر ما فکر کردم که برنامه امروز البته شما دوست عزیز هم خواهش کرده بودین که این بار صحبت شود ولی متاسفانه بر ما مشکل بود که یک مهمان را پیدا کنم که در یک قسمت تخصص داشته باشه ولی خوشبختانه امروز در استودیو مهمان بسیار خوبی را با خود دارم. محترم دکتر سیروس ناصریان که سایکیاتریست هستند و یا متخصص اعصاب هستند امروز در استودیو با ما تشریف دارن و خوشحال هستم که با ما هستیم. دکتر سیروس سلام، خوش آمدید. بسیار خوشحال هستم و از وقتتون بسیار تشکر. دکتر سیروس محترم البته شما آزاد هستین اگر خواسته باشین به زبان فارسی و یا انگلیسی صحبت کنین به خاطر که برنامه را جوانان هم میبینه و افغانای ما که با حتی دوستای ایرانی هم بیننده های ما هستن که در امریکا هستن اونا همشون به زبان انگلیسی آشنایی دارن تو میکس صحبت میکنیم و بعضی چیزا رو چون تلویزیون ما یک تلویزیون جهانی است و سراسر جهان دیده میشه بعضی موضوعات فارسی شما رو به دری خود هم ترجمه میکنم و یا انگلیسی را به دری ترجمه میکنم که همه بتونن استفاده خوب کنن از برنامه. خب اگر در قسمت اول لطف کنید در مورد خود صحبت کنین. شما تخصصتون در کدام قسمت سایکیاتری از اسپشیالایزیشنتون چی است؟
من جنرال سایکیاتریست هستم و
بله.
سپشالتی من ادکشن مدیسن
بله.
و جنرال سایکیاتری. special interest دارم to addiction و ADHD و attention deficit disorder, depression and mental health issues in the elderly.
بله بسیار خوب. پس بسیار موضوعات جالب خوب است. شما میتونین که چند بار دیگه هم در برنامه باشین در مورد هر موضوع صحبت کنیم انشالله. بله.
بله.
خب دکتر صاحب شما پرکتیس شخصی هم دارین؟
بله من تو private practice تو گلندورا نزدیک لس آنجلس.
بله شما با امریکا بزرگ شدین؟
بله تو امریکا.
بله با کجا از کدام مدیکال سکول فارغ شدین؟
من رفتم American University of the Caribbean.
بله.
بعد از medical school رفتم USC University of Southern California برای residency training.
واو رزیدنسی تون به USC که یونیورسیتی بسیار خوب است.
مرسی.
خب دکتر صاحب محترم اگر در قسمت اول درست است که همه آگاهی داریم همه میفهمن در مورد بعضی اوقات می ترم دیپرشن مسیوز هم میکنیم میگیم ها دیپرس هستم و شاید اما تو وقتی که یک دقیقت هم if we are sad میگیم دیپرس. اصلا مریضی دیپرشن و افسردگی یک معلومات امید در موردش بدین چی است چی باعثش میشه؟
I think to English I think that a lot of people have a lot of misconceptions about depression and what it is. I think that a lot of people think that depression is just feeling low or blue, but depression is much more. Depression is something that causes a lot of pain and suffering. It causes a lot of problems in people's lives. They can't go to work. They have difficulty getting out of bed. They might lose weight or gain weight. It creates a lot of problems with their sleep, their energy. They might have difficulty with their relationships because of depression. Maybe they don't show up. Maybe they can't keep up with their relationship. Maybe they don't care anymore. So it really is something that needs to be addressed as a real medical problem. If you have diabetes or high blood pressure, you don't just live with it.
Right.
You don't hope that it'll go away.
Vale.
You go to the doctor and you get help because you know that it can cause problems down the road. Same thing with depression. Depression causes a lot of problems and it needs to be looked at as a medical issue with medical causes and medical treatments.
بسیار خب دوستان عزیز فشرده براتون هم به دری بگویم که قسم که دکتر صاحب گفتن دیپرشن تنها یک دقیقت نیست که موقتی یک دقیقت موقتی پیدا شود و زود از بین بره یک مریضی است اما تو که مثلا مرض شکر و فشار خون کلسترول همه را باید تداوی شود باید ادویه بگیریم و جدی فکر کنیم مریضی افسردگی و دیپرشن هم امی قسم است به می شکل است و یک شخصی که دیپرس می باشه و افسرده می باشه تمام فعالیت‌های زندگیش تغییر میکنه مثلا یا بسیار زیاد میخوابن و بسیار خوابشان کم میشه و یا وزن بسیار زیاد میگیرن و یا وزنشان کم میشه و یا ای که نمیخواین که از نگاه اجتماعی زیاد ارتباطاتشون تغییر میکنه حتی در فامیل زن شوهر و بین فامیل هم ارتباطاتشون تغییر میکنه و از هر نگاه یعنی اثر بالای زندگی انسان داره پس که باید جدی گرفته شود و حتما همونطور که امراض دیگر میخوایم تداوی کنیم مریضی دیپرشن و افسردگی هم باید جدی بگیریم و حتی جدی‌تر باید بگیریم و باید پشت تداویش بگیریم. So what causes depression?
That is a very good and difficult question. If I had the answer, I would be very famous. A couple of things. Depression is caused by genetics. Family history is always very important. I always ask about family history. Depression is caused by how you were brought up, how much trauma you experienced. Depression is caused by what's going on in your life right now. Are you under a lot of stress? Are you under a lot of duress? Are you very anxious because you can't pay your bills? Because you are having a lot of difficulty at work? Because you're being bullied at school or in the workplace? Dynamics. Do you have enough support system? Maybe one person that doesn't have any support system becomes depressed. Another person with the same family history has a lot of friends, a lot of family around them, doesn't become depressed. So all of these things will come together and will dictate whether someone either is able to cope with things moving forward or whether that individual maybe does become depressed and needs to seek help.
اوکی. خب اول بعد سوالی بود که چی باعث افسردگی میشه. البته قسم که دکتر صاحب گفتن یعنی جواب سقیش هیچ کس نمیفهمه. عوامل مختلفی وجود داره که باعث ازی شود، مثلا استرس یا فشارهای روزمره زندگی، فشارهای روحی، مشکلاتی که در کار می باشه، میتونه که ارثی و یا ژنتیکس باشه و نظر به همچنان پرسونالیتی یک نفر که چه قسم است می باشه و یک انسانی که در موقف بسیار مشکل قرار داشته باشه میتونه که برایش افسردگی بار بیاره. برای اطفال و نوجوانا فشارهای اجتماعی مثل که بولینگ که فرض کنین در مکتب شاگردای دیگه اینا را تهدید میکنه و مورد اذیت و آزار قرارشان میده، میتونه که دیپرشن بار بیاره. مثلا اگر یک نوجوان یا طفل که سپورت سیستم داشته باشه و فامیلش بتونه که اونا رو کمک کنه، شاید که از ولادت به اونا اصلا به دیپرشن گپشون نرسه. اما یک شخصی که کسی مشکلش درک کرده نتونه و نفهمه که نفر شخص مشکل داره، اونا سرچار به دیپرشن و افسردگی میشن. با اجازه در یک لاین تلفن میگیرم که هم نوبت شاید بیننده ها زیاد انتظار نمانن. بله بله سلام بفرمایید.
Yeah, hello.
Hello, yes.
I'd like to question something from your psychologist. I understand you have a psychologist there.
Psychiatrist, yes.
Psychiatrist, maybe. Yeah, I want to know if bipolar depression runs in the families or not.
Okay, do you have any other questions?
That's the only question I have.
Okay, thank you. We were going to get to that, so got rid of one question for me.
Okay, perfect. No
one less thing for
problem.
me to ask.
No problem. Thank you, caller. Yes, actually bipolar more than any other type of depression runs very closely in families, sometimes up to 70-80%, particularly in the first degree relatives. So in answer to your question, yes, very strongly, and if there is a family history of bipolar, that's something that other people in the families need to be aware of, because it does increase the risk so much for other first degree relatives, sons, daughters.
How do you describe bipolar, the symptoms of bipolar?
Bipolar depression is different than unipolar depression. Unipolar depression is just a fancy way of saying that someone is depressed, and they're either content or they become very depressed. Bipolar depression is when you have severe mood swings. Some people experience what's called a manic episode, where for some period of time they don't sleep, they are full of energy, they might be talking faster than usual, thinking faster than usual. Some people describe it as they are thinking much faster than they can get the words out. Unfortunately, they also can do impulsive things. People might spend too much money. They might do things that they would never have done in the past. Other people around them might wonder what happened. Their behavior changed so drastically. This behavior can be dangerous sometimes. They can become psychotic. They can hear voices. They can become paranoid. The unfortunate thing is after that mania, they become severely depressed and depressed to the point that they can sometimes take their life.
So it's a type of depression. It's not a personality disorder.
No, absolutely not. It's definitely not a personality disorder. It's not a personality weakness.
Okay.
It's not a weakness of one's character. It's an illness, just like a medical illness, just like diabetes, hypertension. You have bipolar disorder.
Okay. So how many different types of depression are there?
There's depression with different severities. We call them mild and moderate. We call them severe. There's depression that's linked to trauma. There's depression that's linked to grief and adjustment. And then there's bipolar depression. We call it type 1, where people can become very sick and at times take their own life. And there's bipolar 2, which is not as serious, but it does need to be treated quite aggressively.
So you said some of them is caused by grief. So would that be something temporary that the person would probably get out of it quick, or how soon would it take? What does it take?
This is a good question. So with grief, if somebody were to come to me after they lost a loved one, maybe a mom or a father or a wife or a husband, I would try to support them. I would listen to them and let them know that what they're experiencing is normal. I very rarely treat grief from the beginning. I normally like to watch them and follow them. Give them time, maybe see them every month or every 2 weeks just to see how they're doing. The only time I would treat them would be as if they are severely depressed, meaning that they are not eating, they can't sleep at night, they're not taking care of themselves, they're not going to work, they're not doing the basic functions of life. The other reason is if that grief lasts for a few months. Normally I say 2 to 3 months, which is a long time to be feeling that way.
Right.
So after 2 months, if they come back and they say, I'm just not feeling any better, I'm really struggling, I'm crying all the time, I can't sleep at night, I only went to work twice last week and I need to go 5 times, then that would be the time for me to start thinking about more aggressive treatments.
So what kind of treatments would be the options?
If somebody was having a more mild to moderate depression, I might, and this was their first time coming to the office, and they had the time and they wanted to sort of figure out what was going on, I would probably refer them to a therapist, a psychologist, a marriage and family therapist, maybe a social worker that's practicing therapy as well, to see if they can get past whatever hurdles is going on. They're having difficulty coping, maybe with their marriage, maybe they're having difficulty at work with a boss, maybe they're having some negative thoughts that are stemming from childhood, or there's old trauma there that they need to get past. If that doesn't work after a month or two, they might come back to my office and talk to me and say, I've been doing therapy for a couple of months, I'm not feeling any better, I might let's start medication. If somebody came to my office severely depressed, maybe they were thinking about wanting to die, maybe they thought that if they didn't wake up in the morning, that would be okay, or they welcomed that thought. If they were not eating, if they were not going to work, I would say, well, let's maybe combine medication with therapy to be a little bit more aggressive, to try to get them out of that depression so that there's no further damage. They don't have to suffer anymore.
What kind of medications are there for depression? Because sometimes people think that, if I take this medication, we sometimes treat our own, and especially with Google nowadays, everybody think that they know everything, so they can Google information and say, oh no, this is not a medication for me.
Sure.
So what can
I think Google is a good source of information to see what's out there. What Google is not doing that's different than what I do or what a therapist does is that we are looking at the whole picture. So somebody might look up something on Google and they're only getting a very narrow view of something, versus if you come talk to somebody like myself or another therapist or psychiatrist, they're going to be asking a lot of questions, and they're going to be trying to put together the whole picture. If medications are something that is recommended, there's quite a few medications on the market. Some of them are older, some of them are newer, that are meant to target depression. Most of them work on serotonin. Some of them work on something called norepinephrine. Others work on something called dopamine. Some of them are a combination of these different neurotransmitters and receptors. And so under the care of a doctor or a psychiatrist, people are initiated on these types of medications all the time, every day, probably many times an hour. Someone is started on these medications. They are some of the most widely prescribed medications in the world. They're very safe, they're very effective.
So this biochemistry that's causing all this, so is there also like a natural way that we can, like, for example, increase the level of serotonin or anything?
Yes. That's, again, it's another complicated question. We don't have the whole picture.
Right.
We know that serotonin plays a role for a number of reasons, whether it's in the lab or whether it's in the real world. Giving somebody an agent that acts on serotonin helps them feel better, gives them more sense of hope. Unfortunately, most of the time you get a response, but not all of the time do they become happy or depression-free. So there's more going on than just serotonin or dopamine. But to get back to your question, we know that there are non-medicine ways to treat depression. Therapy, for example.
Right.
Psychotherapy, talk therapy, cognitive behavioral therapy. These are ways of changing brain chemistry. It's not just talking, sitting on a couch, and after an hour you go home. There are changes happening in the brain. There are changes in your neurochemistry, changes in the levels of serotonin that do help people get through their depression. So it's not just take a pill and change your brain chemistry. Other things can help as well. Increasing your social network, increasing your hobbies, activities, interests, exercise. These are a diet. These are other ways of helping relieve depression without necessarily taking medication, or maybe in combination with medication.
خب دوستای عزیز، معذرت میخوایم که ما صحبت‌های دکتر سی بر ما بسیار جالب شد، حتی فراموش کردم که بر شما بعضیش فشرده هایش بگویم، ولی بعضی که لین تلفن گرفتیم ان شاء الله که در این مورد صحبت میکنیم. بله سلام بفرمایید، روی خط هستین. سلام به شما. هلو.
سلام.
بیننده عزیز میخواین صحبت کنین؟ اگر صحبت نمیکنین، سوال ندارین، خب وقت دکتر سوم ضایع میکنین. از ما هم اگر سوال دارین نشرمین، بفرمایین صحبت کنین. اگر ما بشرمیم خب چون همه ما رو میبینن، شما را هیچ کس نمیبینن. خب چانس برتان دادم دیگه. البته قسمی که دکتر صاحب گفتن که بالکل فراموش کردم چی، فکر میکنم من هم دیپرشن دارم، زود از فراموش. موضوعاتی را که گفتن که فرض کنین تنها دوا نیست که باید بگیریم، موضوعات دیگه هم است. مثلا باید پیش روانشناس بریم که امروز تداوی‌های دیگه که امروز صحبت میکنه و کانسلینگ میباشه، این همش کمک میکنه. یک جا تنها یعنی دوا یگانه چیزی نیست که کمک کنه و بعضی اوقات تنها کانسلینگ کمک نمیکنه، شاید در دوش باشه و باز لاین‌های تلفن باز هم میگیریم، باز صحبت میکنیم. بله سلام. بله سلام. میخواین صحبت کنین بیننده عزیز؟ بفرمایید.
سلام.
و علیکم السلام، خوش آمدین، بفرمایید.
تشکر. من از دکتر صاحب یک سوال داشتم راجع به cognitive behavioral therapy. میخواستم ازشان پرسان کنم اگر like patient ها که هستن امرای depression آیا میتونن cognitive behavioral therapy عوض دوا بگیرن و خوب از کردیشان بکنن؟
خب بسیار سوال خوب، بسیار تشکر.
تشکر.
خب پیش از اینکه سوال جواب بدین اگر بگوین که cognitive behavioral therapy چی است، باز بعدم سوال بیننده ما جواب بدین.
Cognitive behavioral therapy یک modality of talk therapy, where you go to a therapist once a week at least.
بله.
And it's very active. It's not just talking, how was your day, how was your childhood. They are going to be really looking into your thoughts and how those thoughts affect the way you feel. Because a lot of times people suffer from what's called automatic thoughts. So if you, for example, don't get your job promotion, your automatic thought might be, I'm a failure, or I'm not good enough. Or maybe if you're in school and you get a B and you don't get an A, the automatic thought is, I'm not smart enough. I'll never be good enough to be a doctor, a lawyer, engineer, or a dentist, or whatever you are pursuing. But these automatic thoughts can be very disruptive. They can be paralyzing. And they can cause depression, because if you keep telling yourself you're not good enough, you're not smart enough, you're a failure, that can lead to depression. You start to feel hopeless, you start to feel helpless, and if this happens for your whole life, years, decades, you will eventually become depressed. So a cognitive behavioral therapist will sit down with you and look at these thoughts, look at different scenarios, and start to question, are these thoughts really true or not? Is it true that you're a failure, or you just did not get an A? Is it true that you'll never succeed, or did you just have some trouble in your math class or with your job? It involves going home, doing homework. It's very involved, but it's one of the most effective, if not the most effective, talk therapy technique for depression, anxiety, trauma.
بسیار خوب. خب دوستان عزیز، قسمی که بینیدیم ما در مورد کاگنیتیو بیهیویرال تراپی سوال کردن. یک تراپیست که هفته یک بار باید پیش تراپیست برین که امرتون صحبت میکنه و مو افکاری که اتومات به دماغ ما میایه، مثلا فکر میکنیم که اگر یک نمره خوب نگیریم به امتحان، فکر میکنیم که البته ما به قدر کافی لایق نیستیم، و یا که اگر در کار ترفیع نکنیم خود قسم مقصر میدانیم، فکر میکنیم که ما کوتاهی کردیم، کدام کمبودی داشتیم و خود ما اتومات افکار خود کنترل میکنیم. وقتی که به کاگنیتیو بیهیویر تراپی هفته یک دفعه برین و این تراپیست افکارتان تمامش تجزیه و تحلیل میکنه و امرتون کمک میکنه که امی افکار از دماغتان دور کنین که شما خود کمک کرده بتونین. بله سلام بفرمایین.
Bali Salam. I had a question for Dr. Nasserian. I'm watching the show and I am a big fan, and I think this is a great topic that we're covering, especially in the Afghan community where this is very taboo and there's a lot of shame with depression. So I'm, congratulating everybody for having Dr. Nasserian on the show. My question is, what are some of the warning signs for depression and how to prevent it to turn into suicide?
Good question.
Thank you.
Again, she eliminated one of my questions.
Perfect. Okay.
Make my job easier.
Your audience is ahead of you.
Yes.
Very good.
They read my mind.
Exactly. Very good question. The question was warning signs, risks for depression, for suicide. How can you pick up on it? Maybe you're a friend, a mother, a father. Maybe you think someone might be depressed or at risk. What we're looking for are some of the really traditional signs of depression. Nothing complicated. Maybe somebody is more withdrawn. They're in their room more often. They are not coming out anymore. They don't want to talk to anybody. They're having difficulty leaving their house. They're sleeping all day and all night. They don't leave their room. The blinds are always shut. They have very low energy. The things they used to do, they don't enjoy doing anymore. Maybe somebody was enjoying and loving soccer, and they don't want to play soccer anymore because it doesn't bring them any more pleasure. Maybe somebody's gaining a lot of weight or losing a lot of weight. Maybe somebody is talking more about death or questioning their existence or their life. What is their purpose? It's not any one thing. If somebody is losing weight but they're going about their normal business, or maybe if they're gaining weight and still functional, that's probably not depression. It's a combination of things. You have to again look at the whole picture and see what's going on. Those are some signs that you should ask the person, is everything okay? Are you feeling okay? Maybe you should get help. I thank the caller too for bringing up this very difficult and fragile topic of suicide.
Yes.
It's part of the world we live in. People are unfortunately taking their lives all the time. It's more common than people think. The biggest risk factor for suicide is if an individual had already attempted in the past and maybe failed. But if somebody is talking about suicide, if they're very severely depressed, if they're crying uncontrollably, if they're just not getting any pleasure out of life, or they don't think that anything can help them, this is the time to really promote and lobby for that person to go seek help.
خب بعد از سوال بیننده ما بود که چطور ما علائم خطر در یک شخصی که افسردگی داره ببینیم و چی کرده میتونیم که شخص نجات بدیم از اینکه می علائمش منجر به این نشه که خود ناخواسته خودکشی کنن و علائم از این قرار است که یک شخصی که مثلا انزوا و گوشه‌گیری را اختیار میکنه و همیشه میخواد خواب باشه، میخواد به اتاق تاریک باشه، پرده و همه را بسته بند میکنه که اتاق تاریک شوه، انرژیش بسیار کم می باشه و همچنان در مورد مرگ همیشه فکر میکنه، وزنش کم و زیاد میشه. این علائم است که شاید که این نفر در خطر قرار داشته باشه و مخصوصا اگر این شخص در مورد خودکشی صحبت هم کنه و در مورد مرگ، اینا شاید در خطر زیادتر قرار داشته باشن. این اشخاص کاندیدای هستند که باید به شکل جدی امرشون کمک شوه و برشان باید به یک مرجعی که کمک میشه برشان برسانیم شونه. So how can we help these people? What are the best ways to help them?
So the best ways to help them is to support them. It's important not to judge people. This is, I think, one of the biggest obstacles is we approach depression as though it's a character flaw. We say, just get up, snap out of it, get on with your life. Just think more positively. Everything is going to be okay. For someone that's feeling depressed, none of this helps. For somebody feeling depressed, they can't snap out of it. They can't just get up and get on with their lives. They feel miserable. They feel like nothing can help them. They have no energy. They want to cry all the time. And nothing gives them any pleasure. It's a terrible place to be, and it's a terrible feeling to feel. I think the first and most important thing is to support the person, validate what they're going through. Instead of saying you shouldn't feel that way, you can say something like, it's okay to feel the way you're feeling, we just need to get you help. That way they won't get judged. They don't feel judged. They don't feel like there's something wrong with them. They don't feel like they're going crazy, which is a major problem. People that are depressed are not crazy. People that are bipolar are not crazy. They're people that are suffering from an illness, and they're really having a hard time. So the first step is to support the person, make sure that there's no judgment, and try to support them to go seek help with either a therapist, a psychologist, a psychiatrist. Even going to their primary doc is helpful, because they might have a good relationship with the primary doctor, and they can open up, and the primary doctor might then refer them. And they might be more comfortable with that referral because their doctor said it, who they know and respect.
خب دوست عزیز، قبل از اینکه در این مورد صحبت کنم یک لاین دیگر هم میگیرم. بله دوستان عزیز، سلام بفرمایید. بینید عزیز. بله سلام، روی خط هستین.
سلام علیکم دکتر نصریان جان. سلام علیکم. من یک سوال داشتم از شما. نظرت میخوایم برای دپرشن صحبت میکنین. منتها به استفاده بنزودیازپینز یا زنکس و ارسن متوجه شدیم که موبایل سالا و جوانای افغان ما شما به اندازه زیاد استفاده میکنن. اولی که این دوا یعنی باید با چی استفاده شد و دوم ساید افکتس از این دوا چی هست؟ اگر یک ذره صحبت کنیم خوب میشه.
تشکر از تلفنتان. سوال دیگه ندارین؟
من خیر نیست. یعنی سوال
Merci.
تشکر. خداحافظ.
So the question was about a medication called benzodiazepines, Xanax, Ativan, Librium, Valium. These are medications for anxiety.
اینو همش در جمع بنزودیازپین است. بله.
Anxiety, sometimes they're used for seizures, sometimes they're used to help people withdraw from alcohol. They're great medications. They work very well. The problem is that they are only temporary. And the other problem is that they are addictive. So people become addicted to them, dependent on them, and if they use them for a long time, it creates a whole new problem. So not only are they anxious, but they're now also dependent and addicted to this medication. And they have side effects in the elderly. They can cause memory loss. They can cause falls. People can fall on them, become confused.
Is it because they feel drowsy?
It's because they feel drowsy. It's because they're older adults. They're more fragile. They might take it at night. They get up in the middle of the night to go to the bathroom. Some of the elderly people, particularly men, might go to the bathroom 2-3 times in the middle of the night. So if they're confused in the middle of the night, they might go off balance and then they fall. They might break a bone. They might break their hip. In the younger population, problems with addiction, dependency, and you'll always need more of this medication. And it slows down the way you think. It basically acts on the same receptors as alcohol. So if you drive while on Valium or Xanax, it's as though you're driving on alcohol. So it increases the risk of accidents. It has interactions with other medications as well. I use these medications on a daily basis, but I look at them as a very temporary measure, maybe for a couple of weeks, until the person is feeling better, and then immediately try to get rid of them, try to get them on something else.
So how long would it take for someone to get addicted to these medications?
Not very long. I think if you're using the medication regularly every single day, we're talking a matter of weeks, maybe 3-4 weeks, before your body becomes dependent on it. And then it becomes very difficult and tricky to get yourself off of it.
Okay.
And it's painful. People become very anxious. They go into panic if they try to get themselves off too quickly.
Okay. خب با یک تلفن دیگر هم میگیریم. بله سلام بفرمایید.
بله سلام.
سلام بفرمایید. روی خط هستین بفرمایید.
از کالیفرنیا گپ می‌زنم سان فرانسیسکو.
بسیار خوب سوالتون چی است؟
بسیار خوب.
سوال من است که ما چند وقت میشه که دپرشن گرفتیم گفتم که اگر از دکتر سر پرسان کنم که دوا بگیرم چی فایده میکنه بر ما بهتر میشم یا اینکه برم نقص میکنه.
خب شما یک لحظه باشین. شما چی میفهمین که دپرشن دارین؟ آیا سوال دیگه دارین از پیش از اینکه خداحافظی کنیم؟
نه مرسی.
سوال دیگه ندارین از اینا؟ خب خیلی از طریق تلویزیون گوش کنین شما. شما سوال دیگه ندارین بله؟
نه.
خب تشکر.
Gotcha. So people that are depressed, particularly moderately depressed, severely depressed, meaning that the depression is really taking a toll on their lives, they do well with medication, and we do see them responding well to medicine. The response rate for being on a medication is 30% to 60 to 70%. So if 10 people took it, 3 people would be no longer depressed after a month or two, and then a good majority of them would feel better. They may not feel 100%, but they will feel more hopeful. They might be able to go back to work. They might have more energy. They might enjoy soccer more. They might enjoy playing a music instrument more. They might be more socially engaged, going out more, spending time with people, going to parties and things like that. So the treatment for depression is real. It's good, but it's not perfect, just like everything else in medicine. So people that are depressed, that are really suffering, should expect a positive response if they seek treatment.
So should a person start medication right away, or should they try other venues like counseling and cognitive behavioral therapy and all that, or they should start both at the same time? What's your suggestion or advice?
I think that's a complicated question. It has to do with a lot of things.
I'm sorry for asking you all
this. No, I thank you for this is a complicated field. Yes. Because a lot of times there's no one answer.
Right, I understand.
So.
And I'm kind of thinking for my audience, I know they're going to be thinking those questions.
Of course. No, these are great questions. So whether to start medication or whether not to start medication is really a discussion that an individual should have with their psychiatrist. There are questions that a psychiatrist would ask, such as how severe is the depression? That would be the most important question. Is it very severe? Are you suicidal? Are you safe? First and foremost. Other questions that would be important is, have you been depressed in the past? How did you get past that? Did you go to therapy? Did it just go away after a few months? Did you go on medication? Family history, very important.
Okay, was that important?
That's very important. Is anybody in your family depressed? Yes, my mother is very depressed and she takes Prozac. So that would be a contributor as well. One thing that I have not talked about, which I feel sorry about, is that one of the important things about depression is it can be caused by alcoholism, substance use, and it can also increase the risk of going in that direction.
Okay.
So that would be another thing that I would want to
So
talk
it could be
about.
caused by that, or depression itself could push you toward it?
Absolutely.
Okay.
For example, an individual is having difficulty coping, they don't feel connected to the people around them, they don't know how else to cope, might turn to alcohol, they might turn to drugs. On the other hand, an individual that is an alcoholic, drinking heavily, might become depressed because alcohol is a depressant. And over 70% of people that stop drinking, that are alcoholics, no longer are depressed after some time. No medication, no therapy. So the alcohol was really pushing their depression.
Okay. Are there any medications that if a person takes it for another illness that would cause depression?
There are. One of the callers mentioned the Benzodiazepines, the Valium, the Ativan, the Xanax. Those are depressants. They can cause depression. A lot of people are on beta blockers. Those can cause depression. Propranolol for hypertension, for high heart rates, tachycardia. That can cause depression as well. Steroids, medications for arthritis, for chronic pain, any number of illnesses. Steroids are used for so many things. That can cause depression. That can cause people to have behavioral changes. That can even lead to bipolar episodes. So the medications that you're on can definitely have an impact on how you feel.
Right. خب دوست عزیز فشرده اما چیزا رو براتون بگم. یکی که چطور ما میتونیم که یک شخص کمک کنیم که از افسردگی اونا رو نجات بدیم و یا کمکشون کنیم، باید که ما جاجشان نکنیم، در موردشان قضاوت نکنیم و برشان نصیحت نکنیم که تو دیگه مثلا نشانشان ندیم که ضعف از اوناست و میتونن که خودشان خود کمک کنن، میتونن که باید دیپرس نباشن. این یک کار است که شما یک نفر مشکلش زیادتر میسازین، بلکه شما باید سپورتشان کنین، پشتیبانیشان کنین و اما مشکل را که داره شما تصدیق کنین و بگوین که بله این مشکل داری و ما امروز کمک میکنیم و به مرجع یا میبرینشان و یا نصیحتشان میکنین، راهنماییشان میکنین، تشویقشان میکنین که کمک بگیره. نه ای که بگوین مثلا بعضی عادت دارن که میگن خب البته ایمانت ضعیف است یا انسان قوی ارادت ضعیف است. این از ضعیف بودن نیست، ضعف انسان نیست، یک مریضی است و وقتی که یک شخص با ما میفهمیم یک نزدیک ما این پرابلم داره، ما باید قضاوت در موردشان نکنیم، قضاوت منفی، بلکه باید مشکلشان را تصدیق کنیم و اونا را تشویق کنیم که کمک بگیرن. و همچنان بیننده عزیز ما که در مورد بعضی ادویه ها سوال کردن که از جمله زنکس و اتون و والیوم و بعضی دوایی هستن که دیپرسنت هستن، بله، و این دوایی هستن که اینا مردم یعنی یک انسان میتونه به بسیار زودی محتاج شود و چیز نیست که مشکل کاملا حل مشکل باشه، برای ما صورت موقتی شاید ما را بهتر بسازه، آرامتر بسازه، اما در از مدت هم محتاط میشیم و هم شاید عوارض دیگه هم داشته باشه. بله. و دیگه ارتباط مشروبات الکلی با افسردگی که دو جانبه است. اگر یک شخصی که محتاط به الکل است و الکلیک هست و همیشه مشروب میخورن، این خودش باعث دیپرشن میشه و اینا منجر به دیپرشن میشه و منجر به افسردگی میشه. و یا همچنان یک انسانی که بسیار افسرده و دیپرست هم باشه از بعضی اوقات خود رای دیگه پیدا نمیکنه، فکر به الکل رجوع میکنه، فکر میکنه که اگر من مشروب استفاده کنم شاید که مشکل من حل شود و به دیپرشن من شاید کمک کنه، که هم خودش یعنی یک اشتباس و مشکل زیادتر میسازه. بله. خب دکتر صاحب، بعضی اوقات بعضی ها فکر میکنن که مخصوصا ما شرقی ها زیاد فکر میکنن که ادویه های گیاهی یا herbal medicine و یا حتی homeopathic medicine شاید کمک کنه. اینا من میخوایم سوال کنم که آیا اینا تنها just by itself کمک میکنه یا نه، و همچنان یک شخصی که اگر زیر تداوی دکتر سایکیاتریست است دوا میگیره و ایره هم امروش یک جا میکنه و دکتر خود نمیکنه، آیا کدام ضرر برش میرسونه؟
Again, a complicated question. Sometimes I have patients that come and ask about alternative medicine, herbal medicine. Some of the popular ones are medications like St. John's wort for depression, ginkgo biloba for memory. There are countless herbal medicine on the market. The problem with the herbal medicine, the problem with that market is it's a big market, but there's no evidence. So anybody can put anything in a tablet and put it in a bottle and say that it does whatever they want to say it does. Some of the alternative medicines like St. John wort actually does work at higher doses. The problem with St. John's wort is it can have some very dangerous interactions with some of the medications that I prescribe. So I never tell my patients don't do that, don't take that, but I want to know as much information as possible. So if you are taking an herbal medication, something that you bought over the counter at the pharmacy, at the health food store, please share that with your doctor, because the interaction between St. John wort and, for example, Prozac can lead someone to maybe die or go to the hospital. So it's very important that your doctor knows what's going on. And if you come in with the medication and somebody like me doesn't know, then I can always look it up and find out exactly what it is.
And I'm sure you're familiar with ashwagandha. A lot of people talk about that. Is that also one of things that we should not mix it with medication?
What is it called?
It's called ashwagandha. It's a herbal thing.
I have not heard of that.
Okay. Then we should stay away from it.
Well, not necessarily. Maybe I just need to do some more reading.
And how about homeopathic medicine? Same thing.
Homeopathic medicine, again, some people benefit from homeopathic medicine. But I think it's an important discussion to have with your doctor to at least let them know that you are looking into alternative means. Because the allopathic doctors are practicing differently than the homeopathic doctors. So a lot of times the things that they're doing that I don't know. It's a different school, it's a different direction. But I want to know that an individual or a patient is moving in that direction so that I can gather as much information as I can. To know what they're on, to look it up on the internet or in the drug book.
Okay. خب دوست عزیز، سوال از قرار بود که بعضی اوقات ما ترجیح میدیم که ادویجات نباتی استفاده کنیم، چیزهای طبیعی استفاده کنیم. این چیزها را باید که با دوای طبی مخلوط نسازیم بدون از اینکه به دکتر خود بگوییم. اگر ما وقت میخواهیم که بسیاری از این چیزها را استفاده کنیم به خاطر که فکر میکنیم که طبیعی است و استفاده کنیم، شاید که یک تعامل کیمیایی مختلف امرای دواهایی که میگیرین صورت بگیره و شاید که به جای مفاد هم دوا براتون نقص کنه و هم امی مواد گیاهی که یک جای شوه شاید به جای مفاد یک ضرر برسانه. پس اگر شما فکر میکنین که شاید از استفاده مواد طبیعی و گیاهی و یا هومیوپاتیک مدیسن شما استفاده خوب کرده میتونین و هم پیش دوای دکتر طبی هم میگیرین باید حتما چیزایی را که میگیرین همیشه به نزد دکترتان ببرین که اونا با مو کتاب ادویجات خود ببینن و یا یک ریسرچ سرش کنن و ببینن که موادی که در وجود داره چون اینا کلش یعنی درست تمام اینگریدینتس و موادی که در بینش هست کلش لیست نیست و FDA approved هم نیست بله؟
نه.
Food and Drug Administration اینا را یعنی تصدیق نکرده و فقط که به بازار ولی عرضه میشه فروخته میشه و از اون لحاظ بسیار ضرور است که اگر از این چیزا استفاده میکنین باید امروی دکترتان به تماس باشین و ببینین که اونا نظرش در این قسمت چی می باشه. خب دکتر سب is there a way کدام راه جلوگیری برای depression و افسردگی امکان داره؟ Is there a way to prevent depression? Is it preventable?
Yes, there are ways to lower your risk for becoming severely depressed, one of which we've talked about, to know what the risk factors are. Because depression doesn't start, you don't wake up in the morning, one morning and become,
Tuesday I'm depressed.
I'm severely depressed today and I'm thinking about taking my life. It always starts slowly. Maybe you're feeling a little blue. Maybe you're more isolated. Your energy is down. Maybe you might take a day off work here and there. And so it moves from mild to severe. So knowing that there's a problem is the first step. Other ways of decreasing your depression risk are having a good social circle, a good social network, family, friends, so you don't feel isolated. So there's a lot of engagement, interaction, a lot of dynamics between people, things to do with people, hobbies and interests as well. That's a good place to start to lower your risk. Exercise routine, exercise regimen, these are ways of keeping up your self-esteem, keeping your weight low, looking good and feeling good. Exercise releases endorphins, it creates structure to your life, keeps you active. Having things that you enjoy doing, whether it's work, whether it's a hobby, a musical instrument, a sport, all of these things again together combined will lower your risk.
How about our diet? Does it have anything to do with it?
Diet certainly has to do with the way that you feel. How you eat affects the way you feel. So if you're eating very poorly, you're not going to have the energy. If you don't have the energy, you might not want to go out. If you don't want to go out, you might become more isolated. If you become more isolated, you might start to have negative thoughts about yourself. If you have negative thoughts about yourself, you might start to feel depressed if these negative thoughts continue day in and day out. So I think eating nutritional food, keeping your meat intake low, having a balanced diet, again, it's just one more piece of the puzzle, of this very complicated puzzle.
Okay. برای البته سوال این بود که آیا از افسردگی جلوگیری کرده میتونیم قابل جلوگیری هست یعنی امکاناتش هست بله و اگر ما کوشش کنیم که همیشه خود تنها نگذاریم امروی دوستا و رفقای خوب باشیم از نگاه اجتماعی مشکل نداشته باشیم و همیشه به اطراف ما همه باشه و همیشه اکسرسایز کنیم و همچنان که اکسرسایز یک مواد کیمیایی به نام اندورفین زیاد میسازه ترشحش که او باعث ازی میشه که جلوگیری از افسردگی میکنه و از خود مواظبت کنیم کوشش کنیم که همیشه منظم و خوب معلوم شویم به خاطر که اونمون خودش بر سلف استیم ما و یا به روحی ما را قوی میسازه و حتی غذای خوب ضرور است که غذایی که به ما انرژی بده که بتونیم ما فعالیت‌های روزمره خود ادامه داده بتونیم و اگر انرژی نداشته باشیم واضحه است که در انزوا قرار میگیریم و همچنان علائم ملک در موردش صحبت کردن که علائم خطر افسردگی است اگر او علائم در خود ببینیم زود یک کار در موردش کنیم که پیشرفت نکنه و این راههای جلوگیری از افسردگی است. خب دکتر سب چون وقت کم مانده میخوایم که در مورد افغان هلت اینیشیتیو و اقدام صحی در مورد افغان ها که شما هم در اونجا یک نقش خوب دارین در قسمت صحبت کنین که هدف چی است رول شما چی است پروگرام های دیگه چی است
Afghan Health Initiative was started a few years back. It's an organization that was made by Afghans for Afghans. The goal is to try to build empowered communities through healthcare education and healthcare intervention. So far, we've done a series of picnics, melas, and events. The next event is actually going to be March 26th, 2016. The goal is to try to bring awareness and insight about healthy living. Some ways that we are promoting doing this are weight management, diet, exercise. Of course, mental health is a major part of this, and also preventive disease. So we are trying to bring awareness and education about health to the community at large. For people that are interested, we do have a website, the Afghan Health Initiative at gmail.com. Again, Afghan Health Initiative at gmail.com. And we want people also in the Bay Area, Northern California, to know that while this event and organization started in Southern California, it will be moving north. So if people are interested, please do get in touch. You can also call the show here or email us. And part of this is also recruiting a number of Afghan families to be part of this to start a real trend and momentum towards health and awareness.
بله سلام بفرمایید.
Hi, I'm calling to ask if the doctor could please talk about the topic of postpartum depression. I have a family member who I think is going through it, and I'm concerned.
Very good question. Thank you.
Thank you. Postpartum depression is a very serious topic. It's serious because most women have this idea, and maybe this is a myth, that once you have a baby, life should be spectacular, and you should be feeling very happy and joyous, and there should be fireworks. But in reality, having a child is actually a huge responsibility, a life-changing event. It's very painful. Childbirth is very painful. It changes your whole body. And then you have the baby, and then you go home, and there's something new that you're responsible for. And a lot of women also have difficulty coping with this, number one. Another factor is there are huge hormonal changes that go on. Once you have the child and you give birth, there's a huge fluctuation in estrogen and progesterone. And so this is a topic that I think has only recently been coming to the forefront as something very significant. There's something called baby blues. Some mothers go home, they might be tearful, they might cry immediately after delivery. And that has to do with the hormonal changes, and that goes away after a week, maybe 2 weeks. But if these crying episodes continue, if there's any link to a lot of sadness or hopelessness, despair, if the mother doesn't want to bond with the baby, is not spending time with the baby, is leaving the baby to cry, this could be signs of postpartum depression, which can be serious because if it gets bad enough, mothers might become suicidal. They may even become homicidal to their own child, believe it or not. This happens rarely, but when it does happen, it's very serious. So postpartum depression is real, and it's something that should be taken seriously.
Okay, so you're talking about the hormonal fluctuation. That's happened. Does that also cause depression during premenopause or menopause also?
Yeah, a milder variation because of a milder hormone movement flux will cause what's called a premenstrual dysphoric disorder. So around the time of a woman's menstruation, they might become irritable, very depressed, anxious, mood swings. That tends to go away, but can be impactful on their job or the people around them.
خب بسیار تشکر دکتر صاحب از وقتتان، از معلومات بسیار خوبتان و با انتظار همکاری های هرچی بیشترتان.
تشکر میکنم.
خب دوستان عزیز ارجمند، این بود برنامه امروز ما در مورد افسردگی و دیپرشن و همچنان اگر دوستای عزیزی که خواسته باشن که در قسمت کیس استدی افغان هلت انیشیتیو حصه بگیرن و همراهی کنن، بعد از ختم برنامه امی تلفن شماره تلفنی که روی صفحه تلویزیون میبینین شما میتونین تلفن کنین و با ما به تماس شوین که ما معلوماتتون بگیریم که امرتون به تماس شوین و البته باز دکتر صاحب امر شما ما یک بار صحبت میکنن و البته اول معلومات براتون میده که ما چطور شما میتونین کمک کنین و در مورد افغان هلت انیشیتیو معلومات بیننده های ما ان شاء الله که زیاد است، به خاطر که دکتر صاحب عبدالله شیرزی و دکتر صاحب عایشه شیرزی چندین بار در این مورد آمده بودن، صحبت کرده بودن و همچنان همسر دکتر صاحب ناصریان دکتر فرشته عطایی هم با دکتر صاحب شیرزی اینجا بودن، در مورد صحبت کرده بودن و برنامه های هم بوده که و یک میلی که در 9 آگوست هم بود. ان شاء الله معلومات در این قسمت کافی است، ولی اگر میخواین که شما در این قسمت معلومات بگیرین و که شما به اصطلاح به حساب کیس استدی اینا گروپ کمک کنین، شما لطفاً با ما به تماس شوین و همچنین بر ما هم میتونین شما اگر حالا نمیتونین تلفن کنین ایمیل کنین و ما ایمیل شما را هم برای همه اشخاصی که مسئول افغان هلت انیشیتیو هستن برشان میرسونم. خب با تشکر مجدد از دکتر ناصریان و همکار عزیز